Isolation.
Isolation for what?
Contamination.
Why?
عشان ما نعملش contamination.
Yes.
حلو contamination.
So saliva usually contains bacteria, and when we do root canal treatment, especially for vital teeth, which are not infected, we want to keep the canals clean or sterile as much as possible. We want, because actually it's not a perfect seal, but it will minimize the chance of infection and contamination by saliva. This is one. Also isolation, because we want to isolate the patient. We don't want any instruments to be dropped inside the patient's guts. Okay? So these are the main two functions. And third one is it will keep the patient silent. So this is very useful. Okay? So the rubber dam kits come with teeth, puncture. This is not included, I'm just kidding. It comes with a puncture, okay? So you can use it to create the holes inside the rubber sheet. It comes with the forceps that will hold the معلش صوت. Sorry. Students, so we have the puncture here. We have the forceps that we hold the clamps with. These are the clamps that hold the rubber sheet and the metal frame. Okay? Starting with the clamps. Now the idea of the rubber dam is that we use these clamps to hold the rubber sheet over the teeth. Okay? So the clamps, we have several types and shapes. It depends on the tooth you are doing treating, and it depends on the way you are gonna place it. Now, let's say about the components of the clamp. You have the bow here, the metal bow, and you have two jaws that holds or press against the tooth. Now, some of these clamps comes with these wings here. You see the metal on the sides. These are wings, and some come without wings, so we call them wingless. Okay, we don't have it here. And there are two holes through which we can apply the forceps. So these metal pins will go through the holes of the clamp. Okay. Now the forceps, usually we hold the clamp with the forceps, and when we press it, it will separate the jaws this way. Okay? So logically, when you want to apply it on the tooth, you have to press the forceps and place it over the tooth like this, and then release. Okay? Then take it out. This is the principle, right? This piece here will be helpful if you, instead of keeping the pressure over the forceps until you place it, you can lower this piece so it will keep the jaws open. So if you want to put it back, you have to press it inside and then release. Now, also among the types of clamps, they can differ depending on the tooth type. So for isolating anterior teeth, we have the butterfly clamp, this one here. Okay? So usually the butterfly is just suitable for the anterior teeth, so it can fit this way. Okay? كله من عيده هلا بس نعطيكم الفكرة من Now, if we are isolating posterior teeth, always remember that this arch should be placed distally. Okay? So the arch, whenever it's placed, it must be distal, not mesial. Why? Because if it's mesial, it will interfere with our access. You know, we have only access through the anterior teeth, mesial. So if it's placed this way, we won't be able to access freely to the axis. Okay? Now, the puncture comes in this wheel that has different types, different sizes. نحكي عربي؟ كل بفهم عربي هون؟
من عربي وانجليزي يعني.
عربي لا خلينا انجليزي.
So we have different sizes of holes. It depends on the tooth you are treating. If you're treating a molar, you need a large hole, so you can fix it on the largest hole. If you're treating lower anterior teeth, you need a very small hole, so you pick this one here, okay? Now, let's say we are gonna place our clamp on upper right molar, okay? So this is the proper clamp for the upper teeth. The characteristic about it is the jaws that are not similar. So you have this smaller than this one. The reason is that the smaller jaw lays against the palatal root, and the bigger one lays against the buccal aspect of the tooth. Okay? So this goes for the upper right. The upper left will be switched. Okay? Now also the jaws are serrated, because it will give better retention. For the lower, both jaws are equal and they are not serrated. Okay? We have also clamps for the premolars, which come in smaller jaws. So here, the first thing we do before placing the rubber dam, we prepare our rubber sheet. Okay? Now the rubber sheet comes in different types, materials, and different sizes. Now this is made of latex rubber. Okay? We have now latex-free rubber sheets or sheets, which are more common now because hospitals are turning into rubber-free environment, because many patients complain of allergy. Maybe not here, but in Europe, many of the hospitals are preferring using latex-free materials like gloves, like rubber sheets, and all of these things. Okay? So let's say we have this sheet. To place it, the first thing we have to do is to divide it into 4 quadrants. Okay? So imagine, or you can draw a cross in the middle of the sheet. This cross will divide it into 4 areas. Now each area is corresponding to 1 quadrant. Okay? So this is upper right or upper left. This is the upper right, lower right, and lower left. Okay? Now at each quadrant you can imagine an arch that represents the distribution of teeth. So at the top of the arch we have the incisor, central incisor, and at the end of the arch is the last molar. Okay? So you have incisors, canine, premolar, and at the end you have molars. Clear? Now this, either you can draw it or you can imagine it on the sheet. Now what you will do now is, after you decide which tooth you are treating, you have to create a hole at the corresponding side or corresponding place of the tooth. So if I'm treating upper left central incisor, my hole should be here at the position of the X. Okay? If I'm treating upper right molar, then I should create the hole here. Okay, at this side here. So now I'm doing the upper right. I'll put the largest hole here at the puncture, and then we'll hold it this way at the side where I'm going to place my clamp. Now when you press, be firm, so you don't press it lightly, press with force until you hear a sound like clicking. Hear it now. Okay? When you hear it, keep pressing, and make sure to release your rubber like this. Okay, while I'm pressing. Yeah? Now then take it out, and you'll have your hole ready like this. This one. Okay? Now the next step, I have to fix the clamp on the rubber. Now remember, we said the arch or the bow of the clamp should be distally. So here on the rubber sheet, where is the distal and where is the mesial? The top is the mesial and the lower part is the distal. If I'm doing the lower jaw, the lowest point is mesial and the middle is distal. Okay, so always make sure that your bow is directed toward the middle of the sheet. Okay, so here now this is the function of the wings. It helps holding the rubber sheet against the clamp. If you take it around, see it around, you will see that the wings are underneath the rubber, while the clamp and the bow is above. So the rubber is held in between. This side of the bow, like this. Okay? So it's held like this now. تيجي من تم المريض. So this is upper. You place it. So look now, while I'm placing the rubber dam, I'm looking through the hole. So this is how you look at your tooth. It's difficult to look from the below or the side. So always look at your tooth through the hole and see.
I can see when
So now it's placed. Okay. Still there is something. Last thing we have to do is to release the rubber on the top of the wings. Now I'm gonna do one and leave one without release so you can see the difference. Okay. You can use your fingers or you can use the plastic instrument. Do you have plastic instrument here? Can I use this one? Okay. So take it around. Look at the buccal wing is still covered with rubber. This is not complete. The lingual one or the palatal one is over the rubber, which is the correct one. So both sides should be like the palatal one.
بس دكتور لسه في فراغات شوي.
ما لسه ما خلصت.
ما لسه.
بس بعدين
This way. It's easier with a plastic instrument. Like this, okay? So now both wings are, you can see them both, okay? We have also to check that the clamp is well seated, so place your fingers at both sides and make sure it is stable, because sometimes the clamp may be larger, smaller, the tooth structure is not is not allowing stable placement, so you have to check it is stable. Okay, everything is fine. Now we have to place the frame. Now the frame here, we have several types, several shapes, but the main difference is in the material. So we have the metal frame here. Sometimes it comes in plastic. What do you think the difference is? What's better, plastic or the metal? Metal. عشان radiographs, right? So it's better to use the plastic, but it's not wrong if you're using the metal. But if you're taking radiographs, you have to take the metal frame out. Okay? So the proper positioning of the frame is this way. So the curve, the lower metal should be lower, it's not upper, and the curve of the lower bow should be parallel to the face. So this is wrong. And most of you will be doing this next year, I know. And this is wrong. So this is the proper way, okay? Keep it in mind. The idea is you stretch the rubber this way. Anterior, this is anterior. So you stretch the rubber this way to hold طبعا المouth أسهل. Stretch it this way so it will hold the frame. Okay? So this will be outside the patient's mouth and it looks like this. Okay? So all you will see is the tooth. And this will be distal, so your access will be actually from anterior. المعكوسة, yes. بس تمه هيك بتكون الفريم هيك.
كيف هيك تدخل جوا؟
لا ما بتدخل لجوا لانه عندك انت الماوث. So the lips will be pushing it outside this way. لا أنفه you can fold it. بتكون تحت مستوى الأنف. بس إذا ما انتبهتي ممكن تخنقي. Okay?
مش مشكلة.
So this is for the clamp. When you finish, either you take the frame out first, and then you take the forceps the same way. You insert the pins inside the hole, you press it this way, and take it off. Okay? This is way of placing rubber dam. There's another way which can be used for this stuff, for the winged clamps, or for the wingless. So if you have a wingless clamp that doesn't have these wings, you can't use this method that we just described. The method we use for that is we place the clamp first, and then we place the rubber dam over it. But before doing that, we have to secure the clamp. Actually, securing the clamp should be always done, even with the first technique that we described. This is important because it could be easily lost or dropped inside the patient's mouth. So instead of swallowing it, we have also always this floss holding the clamp and preventing it from going into the patient's guts. Okay? So you put your floss inside one of the holes and tie 2 knots at least. 1, 2, okay? Make sure it's holding it properly. And then you take the floss around the bowl. This way.
كفي.
قطعت ايدي يا زلمه.
مشكلتك.
So take it around. The floss should be tied through one hole, and then take it around the bow, and then insert it to the other hole. You apply it the same way on the tooth, like this, okay? But without the rubber sheet. Now the next step, after you put your hole and everything is fine, you bring your so usually you'll be doing it this way. You take it over the clamp. And then we have to push it, the plastic instrument carefully. This way. And this way, okay? And release the back. You might use the floss to make sure that it's properly inserted between the teeth, like this. Okay? Same result, but different technique. Okay? So either you place it on the rubber sheet and place them both together on the tooth, which is easier, or you do it this way. Okay? This is rubber dam. خلاص هلا طلاب اللي بدهم يشتغلوا اي واحد بيكون معه الكيف واي حدا مش لابس لاب كوت